Greetings to all. Thanks to All India Ophthalmological Society and Asia Pacific Academy of Ophthalmology to giving me the opportunity to present my work on innovation of new crutch glass for ptosis. So what is ptosis? Ptosis is derived from the Greek word fall. Blepharoptosis is upper eyelid drooping with the eyes in the primary gaze. Ptosis can occur in all age groups, and one must remember that when a patient presents with a complaint of drooping, it's merely a symptom and not a diagnosis. Therefore, a thorough evaluation is utmost importance. Ptosis can occur as true ptosis or pseudotosis. True ptosis can be further classified based on the age of presentation, like congenital or acquired ptosis. Because of ptosis, the visual axis is obliterated, therefore the vision of the person is hampered. So hence, if not treated in time, it can aggravate the conditions like amblyopia or astigmatism. Here in this presentation, I will mainly concentrate on acquired adult ptosis, which can be neurogenic due to defective innervation of levator muscle. Example in Horner syndrome. Myogenic due to defective neuromuscular junction, example as in myasthenia gravis. Mechanical due to the mass effect of some lesion like chalazion or neoplasm. Aponeurotic because of dehiscence of the dehiscence or defect in the aponeurosis of levator muscles, example in involutional ptosis, aging, trauma, and last but not the least, traumatic ptosis. So how is ptosis recognized? Ptosis is recognized by the MRD1, which is a marginal reflex distance from the upper lid to the corneal limbus or to the pupillary light reflex, or a distance from the center of pupil to the upper eyelid, which we call as, or the vertical palpebral fissure height is also one of the measure to compare the ptosis between two eyes. A marginal reflex distance of less than 2 millimeters or asymmetry of more than 2 millimeters between the eye of a person leads to the diagnosis of ptosis. How it will be managed? Next comes the management. Management can be surgical. In the cases of congenital ptosis, it can be in the form of frontalis bro suspension using fascia lata or some other synthetic material like Mercilin mesh or silicone sling, which is most commonly used nowadays. Otherwise, if the levator function is good, in the children also we can do levator resection. What is non-surgical treatment, especially in the cases of myogenic ptosis? In that case, where it is the ptosis, crutch glass will come into play. So how is this crutch glass different from the previous existing one? It is different because the previous one had a semilunar hinge which was attached to the upper rim of the glass, and when as seen in this slide, it is lifting both the upper lids, but on lifting the lids there was the major function of lids, that is blinking, was hampered, due to which patients had complaint of persistent lacrimation. This is the new crutch assembly. This crutch assembly, as shown in this figure, it is a frame with a crutch. Crutch is crutch is attached to a holder component, which is being labeled as in figure 2 as 2021 and 2 in figure 2. This holder component will hold this spring-like structure, which is the main crutch, having a bow shaped, which will help, this bow will help in lifting the lid, and because of its spring-like function, this crutch is adjusted, and therefore the patient will be able to blink. So this new crutch assembly, which can be used in the case of a unilateral or a bilateral ptosis in the form of one or two crutches, a pair of crutch, is not only having the advantage of allowing the patients or eyelid to blink, but preventing the excessive corneal exposure, conjunctival exposure, corneal drying, by preventing the excessive lid retraction, which was the disadvantage of the previous available crutch glass. As a result, not only this, as we are seeing in all these videos, that how the patient is wearing this glass and is able to lift, and the function of the lid, that is blinking, is not compromised. Hence this crutch assembly is strongly recommended in the cases of ptosis patient due to its cost effectiveness, easy adjustability due to presence of spring, non-compromise with the function of blink. Recently, we have got a patent from Indian Patent Authority for use of this crutch assembly. Thank you.